how do we and the plantar fasciitis, they usually get it early in the morning, and with activity it actually settles down a little bit, but on rest, after a period of rest, it tends to be worse. So how do we treat these conditions? So the strain of the heel pad usually settles down with just conservative measures, things like rest, ice, compression, and a period and maybe non-steroidal anti-inflammatories. You can, if it is resistant to this sort of treatment, you can give them steroid injection. Sometimes with local anesthetic, it settles it down. The stress fracture is different. That you need to be non-weight bearing and give the stress fracture time to heal. So it usually takes about 6 weeks to heal. It can last up to 2 months. And you must not take non-steroidal anti-inflammatories in this because that will delay the healing process. There are conditions like heel pad atrophy, which happens in older athletes, diabetics, those with connective tissue disease, and these people tend to get repeated heel pain when they train. The plantar fasciitis, you treat them with rest and with cushioning, heel cups, medial arch supports. They need sort of orthotics in their shoes. Now, why does it happen in athletes? What predisposes athletes to this heel pain? It's generally improper footwear, lack of padding, improper grounds where they're training. If they're training on hard concrete type of ground, it happens. Also, a change in training routine, a sudden sort of progress to a different training regime where there is more pressure on the heel tends to cause this. So the diagnosis of a stress fracture is through an X-ray and an MRI scan, but I've given you some of the signs or ways to differentiate it short of going through an X-ray and a scan. Now, there is also an update regarding